Welcome, welcome. Thank you so much for joining us, everybody. I am so excited today. We have a special guest. We're going to be talking all about fibroids today. So, guys, before I get into the juiciness that I have for you today, I'm going to introduce myself. For those of you that don't know me, I am Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. My goal is to have my patients feeling good and looking good. So let's see, I'm gonna turn this off. I have some beeping going on. There we go. All right, guys, so I'm gonna introduce our guest today. So Dr. Cheruba Prabakar is here with us today. So let me tell you a little bit about her. She is a board certified OBGYN and minimally invasive surgeon. She owns a practice in the Bay Area. It's a gynecology and surgery practice. She helps women with fibroids live a life with reduced bleeding, pain, and improved fertility. So Dr. Cheruba, thank you for being here.
Yes, thank you so much for having me. Really excited to be here and speak with you and audience. Yeah.
I love it. So let's get right into it. So what is fibroids? What are they?
Yeah, so fibroids are really common. They are benign tumors of the uterus. So the uterus is made up of smooth muscle, and fibroids are essentially little balls of smooth muscle that grow on the uterus. And mostly they are not dangerous, they're not cancerous. There's a very, very, very tiny chance that they could become that, but mostly they are totally benign, and it affects a lot of women. 80 to 90% of women will be diagnosed with a fibroid by the time they age 50.
Wow, I didn't know it was actually that high.
It's very high.
Very cool. So, at least not cool for the patient, but now, what causes it, and is there a genetic predisposition to it?
So we would love to know what causes it. This is a question that a lot of patients ask, and as for patients and physicians, we would love to know, what the reason is so we can actually act on it. But unfortunately, we don't. And the one thing, as you mentioned, is there is a strong genetic predisposition. So a lot of patients who come to see me with fibroids will say like, "Oh, my mom had it, my aunt had it, my grandma had it," and there's a strong family history of it. So if you have a family history of fibroids, which if you don't know if you do, you should find out, because a lot of people don't talk about these things. But that is one. Diet and lifestyle are increasingly known, and are being shown to actually have a role, just like in all other disease states. And so that maintaining an ideal body weight and being healthy, definitely also can play a role. But the main one, as of now, is genetics, and there's a lot of research being done.
That's okay. What symptoms for women that have fibroids? What are the symptoms they have?
I think the biggest one is heavy bleeding. When a woman says, "Okay, I'm getting my periods, they are regular, but they are super heavy. I'm bleeding through, several pads or tampons every day," that in my mind is a red flag for fibroids. So that is the most common, I would say. Other symptoms can also include just feeling a bulge in your belly. When fibroids get really big, they may not cause bleeding depending on where they are in the uterus, but patients will say like, "Oh, when I turn or when I get up, I see this big ball in my abdomen," and so that's another one. Patients can also have a painful intercourse, pelvic pain, very, very painful periods, and then infertility as well. Fibroids can cause, depending again where they are, can cause miscarriages. So that's another one to watch out for.
Yeah, the two top ones for sure is heavy bleeding for me with patients, and pain. I usually will do an ultrasound. How do you treat it?
So there are a lot of treatment options. I think one thing that patients should know is if the fibroids don't bother you, you actually don't need to treat it. So sometimes you'll have a very small one, 3 centimeters, 4 centimeters, and they don't really cause any symptoms. It's just there. You don't actually need to treat it. And otherwise, it really depends on what the symptom is. So if it's the bleeding, which as we discussed was one of the first ones, then you've got a lot of hormonal medications you can do. You can do an IUD. You can also remove the fibroid through a procedure called myomectomy. And then if it's really the size, the bulk, the pain, the pressure, all of that, then probably the myomectomy or fibroid removal is your best bet. And then if it's infertility, and it's sitting right in the cavity and causing recurrent miscarriages, then again, removal is the best thing to do.
Gotcha. What about complications? What are the complications of having a fibroid, if any?
I think other than the ones that we really talked about, the other in terms of complications, I mean, if you get pregnant with a fibroid, that can lead to some complications such as preterm labor, sometimes even preterm birth, degeneration of the fibroids, which means the fibroid just sucks off all the blood supply, or rather, the baby sucks the blood supply, and the fibroid is kind of dying off, and so it emits harmful substances that can cause a woman to contract. So that's a complication. But otherwise, the main ones, are just the ones that we discussed.
That's perfect. Thank you so much. So I'm actually going to switch gears. I always ask something about my guests. So um, the question would be, why what you
Why do I do what I do?
what you yeah.
Yeah, so, I really didn't know I was going to become a fibroid specialist. After my OBGYN residency, I did a fellowship in surgery, minimally invasive surgery. So really diving a little bit more into gynecologic surgery. And I happened to train in New York and in Brooklyn, where there were a lot of women with fibroids. And so I felt like a big focus during our fellowship was treating women with fibroids. And so that sort of became a niche and a passion of mine. And then when I finished fellowship, I came out to the West Coast to train to practice in the Bay Area, and my first job was in Oakland, California, where again I felt like the population was very similar to Brooklyn, and I had a lot of patients with fibroids. So I just took an interest in that, and I think there's a lot that we still need to learn and know about fibroids. So yeah, it just became a passion of mine.
That's an awesome answer. Well needed work. So, guys, you've heard it. So, definitely check out Dr. Cheruba if you're having issues with fibroids. Now, Dr. Cheruba, for people that want to get to know you better or look into getting some information about you, where can they find you?
Yeah, so the easiest way to find me is on Instagram at the Fibroid Doc. You can also subscribe to my YouTube channel with the same name, the Fibroid Doc. And then if you are interested in fibroid coaching, you can also reach out to me via DM through Instagram.
Yay. So, this is amazing. Thank you so much. So, guys, you heard it. The Fibroid Doctor, check her out. If you have any questions, check out her channel. And if you're looking for a quality primary care physician, we're accepting new patients at Apple Valley Family Medicine. Our phone number is 304-350-1087, and you can find us online at www.applevalleyfamilymedicine. So, guys, we're all done. Thank you so much, Dr. Cheruba.
Thank you so much for having me. Have a great day.
Thank you. Bye.